Hello, my name is Baylee. I am a social worker here at St. Luke's Cancer Institute. I am based in our Meridian location. I have been with St. Luke's in oncology for 3.5 years. And today I'm going to be presenting on supporting families and communities through cancer survivorship. Most of what I'm going to be sharing today, I have learned through the community of patients and caregivers that I feel very thankful to be able to support in my role. I feel it's really a gift what they share, their vulnerability, and the experience that I get to share with you all today. Next slide. My learning objectives are to help understand cancer survivorship and the impact on family systems, increase understanding of the community implications of rising cancer survivorship, help identify strategies that healthcare providers, families, and communities can use to support cancer survivors' long-term physical and psychosocial well-being. Next slide. So cancer in the family system. I want to share an analogy that a patient provided to me pretty recently, about a month ago. She said to me, cancer is like glitter. When you have a glitter bomb that goes off in a room and there's glitter everywhere, it's all over everything, it's a complete mess, you can't see anything, and you know it's going to be pretty rough to clean up. And you clean up the glitter, and you clean up the glitter, and every time you turn, there's more glitter. You move a little furniture, there's glitter. Years later, months later, you might look around the room, and you're probably going to find a piece of glitter. It's going to be there. There is an impact. And it's often a lasting impact. So understanding that cancer doesn't just impact our patients, but it also impacts those within the family system in different ways. We all approach experiences from what we know of cancer. So there's not just the patient perspective, there's also the caregiver's perspective, the spouse perspective, the parents of the patient. They are going to have a unique perspective that they'll be bringing to the cancer experience. There's the perspective and the experience of children and their knowledge and understanding of cancer and cancer treatment. Cancer creates a dynamic within a family system that really forces adjustment and adaptation. We see role changes within the family system. There's loss of autonomy, changes or loss of control. We see children caring for their parents, caregivers who maybe were once caring for the family system needing care. People having a shift in their ability to bring income into the household. Maybe the person who was driving children to school, they can't do that anymore or for a time being. So there's a shift in the roles. There's a shift in how the family is operating. Another thing that we see that I think is pretty significant is adult children having to maybe move back in with their families doubling up because of the cost of care. This, I think, really highlights that shift in autonomy and control. So as people evolve and navigate the cancer experience, the relationships that once existed have significantly changed. There's additional adjustments that can occur with intimacy, connection, communication, how time is spread out within the family system. The focus of the family system becomes cancer and caring for the person with the illness. Quality of life often changes as time becomes focused on caregiving and attending appointments, managing the needs of the household. There's more time traveling to and from appointments. Many of our patients were once going to the doctor once a year, maybe if that, for a primary care appointment. With a cancer diagnosis, appointments increase sometimes 3 to 5 times a week. Their time completely shifts. So there's less time engaged with hobbies, friendships, time with family, quality time, caring for themselves, and there's more time engaged with cancer and the illness. People tend to enter into a survival mode as they navigate acute stress, and then they evolve through what may come. And those unknowns really increase emotional strain. So not just the patient, but the family experiences increase in fear, anxiety, stress, trauma, a lot of grief and loss. It's not just the patient navigating uncertainty and the unknowns of cancer, it's the family system working to navigate what may come for them as a whole. The financial strain of cancer The National Cancer Institute reports that cancer is one of the most expensive medical conditions to treat in the United States. Many patients are left with loss of income or change in income, increase in medical cost, the cost to travel to their appointments, missing work because of appointments, all creates financial toxicity. This is truly life-altering as the family system navigates the cancer experience. Next slide. Okay. When considering the family system, understanding the role and the experience of the caregiver can improve our ability to provide care and support. The American Society of Clinical Oncology defines a caregiver as someone who provides important physical, practical, and emotional support to a person with cancer. There are different types of caregivers, from live-in caregivers, which would look like spouses, partners, children, parents. There's shared responsibility caregivers, where responsibilities are divided amongst family and friends. We also see long-distance caregiving, so family members, friends supporting from a distance, maybe joining appointments via the phone, making calls on behalf of the patient from a distance. Caregiving is seen as natural. It's seen as what you do for the people that you love. Many people don't ask for caregiving. It's just a natural step that support persons take. 1 in 4 adults in the United States are family caregivers. 2/3 of caregivers report high to moderate stress, and the medical system often ignores or severely undersupports caregivers. The Cleveland Clinic defines caregiver burnout as a state of physical, emotional, and mental exhaustion that happens when caring for someone else. They describe it as a candle that has ran out of wick. It doesn't have what it needs to continue to provide light. This often looks like emotional and physical exhaustion for caregivers, withdrawal from peers, friends, family, not wanting to engage in activities or hobbies, feelings of hopelessness, changes in appetite and sleep, and irritability. The needs that caregivers present with do not align with the resources available to caregivers, and we do see high rates of caregiver burnout in the world of oncology. Next slide. As cancer treatment, access to treatment, and cancer screening improve, we're seeing cancer survivors live longer, and the needs of the oncology population within our community here in Idaho are evolving and changing as well. The workplace has expectations that exist as patients and caregivers work to manage employment and cancer care. Many cancer survivors are working throughout treatment in order to keep their insurance benefits and their income. We see survivors working really hard to navigate employment, managing employment, and follow-up care, and the needs that come with recovering from cancer treatment. Society has pretty high expectations of people to return to work and make money. There are workplace demands, paying bills. That does not pause because of a cancer diagnosis. The rent is still owed on a certain day of the month, the mortgage. That doesn't go away because somebody is in cancer treatment. It adds on to the stress that people are already experiencing in their day-to-day life. There's also an expectation in our society that when treatment is complete, people are fine. You did it. Let's return to normal. Great job. There's a lack of understanding and acknowledgement of the cancer experience, what treatment can do to a person, long-term side effects of treatment. Patients struggle to access care in rural communities due to lack of specialists, lack of treatment options, and lack of supportive resources. So these rural and geographic barriers remain as rural communities work to navigate the healthcare system. Transportation resources are limited, and travel to clinic, the time that people spend traveling to clinic is much longer for patients in rural communities. There are often safety concerns as well in traveling during winter months. So some of us, there are some resources to help with gas cards or lodging at some cancer institutes, but people express concern with driving when the weather's bad or missing work, traveling long distance just to get care. The social determinants of health impact cancer care and the patient experience. So social determinants of health are social, economic, and environmental conditions that impact the health of individuals and populations. These influence health outcomes and inequities. According to the U.S. Census Bureau, 10.5% of the population in the state of Idaho is in poverty, but this does not account for ALICE households. ALICE stands for Asset Limited Income Constrained Employed. 31% of the population in our state are ALICE households, which means they have income that is above the federal poverty level, but not enough to afford basic expenses in the counties that they reside. They're in the gap. These are people who often perform jobs that keep our economy functioning. They work in food service, retail, personal care support, delivery drivers, and many more careers. They are often working more than one job, but they are unable to keep up with the costs of goods and services. This means that 41% of the households in the state of Idaho are working every day to make impossible decisions that look like, am I going to eat today, or am I going to pay for my medication? Am I going to pay my utility bill, or am I going to go to treatment? When patients are struggling to access food, healthcare, income, housing, this can impact the outcome of how they navigate cancer care. It impacts how they navigate the cancer experience, how they can engage with follow-up screenings and care, and appointment attendance. Policy and systemic factors also affect patient outcomes, accessibility to care, and the quality of care that patients receive. There is a significant lack of access and funding for mental health care in the state of Idaho, and there's a lack of equitable care within our community. Long-term care needs for cancer survivors are under-supported. Insurance coverage is challenging. There are transportation barriers and limited access to cancer screenings. I also want to highlight that transportation to medical appointments is not the only systemic concern that we see. Many patients are struggling to get transportation to a grocery store or to a pharmacy. So there are some resources here locally, for example, that I can help patients access to get to a medical appointment, but I don't have many resources that I can provide that will help them get food. There are also barriers related to technology, as many patients don't have smartphones. Internet access is expensive. They may not have cell service where they live at home. And there is sometimes we see inability to use healthcare systems like MyChart or Epic and communicate and track their care using technology can be challenging. Every year, people and patients experience the stress of choosing an insurance plan and working to navigate if their insurance coverage will cover cancer-related care needs, is a network with their care team, or has coverage for their medications, which are very, very expensive. They also experience stress of paying a yearly deductible, high copay costs, and navigating the insurance system, insurance denials. Our society is really being called to adapt to support the population as they transition through the cancer experience. Next slide. So what do we do about it, right? I think a lot of us here want to help and support. What do we do? I have come up with the 5 R's. Recognize, refer, resource, respond, and rally. So recognize, acknowledge the experience. Honor what patients and caregivers are going through, what they've been through, what they may go through. Recognize that people may look one way. They might present like everything is okay, but it's important for us to connect with how they feel. Ask, check in, ask the questions. Refer, provide referrals, share information. I think in this ECHO series, we've really learned a lot about different resources that are available, and sometimes it's our role to really bridge that gap. Resource, so not just connecting patients and caregivers to resources, but connect, create, and coordinate with mutual aid networks. Use your skills and your knowledge and your resources to strengthen and create bonds within your community. Rural communities are truly the experts at this. They're experts at caring for each other in really creative ways. So some additional examples might look like Facebook groups, little free food pantries, little free libraries, buy nothing groups. Respond, so adapt alongside the people that we're caring for. The needs of the patient, the caregiver, the family, and the community will change as they navigate cancer. It's really part of our role to change our approach, increase our knowledge, and align with what change looks like on a case-by-case basis. And my 5th R, rally. So vote, please vote, advocate for your patients, talk about cancer, talk about it in your community, not just with people who work in oncology. We have a privilege in our role to know what our patients and the people we support are going through, and we can tell their story in a meaningful way to create change within our community. Next slide. I just wanted to create a slide with some resources that we use here in, at least in my role at St. Luke's. Some of these are books, some of these are websites. There's literature you can utilize, there's videos, but different things that we connect to that really help support patients through the cancer experience. I just wanted to kind of share some of those. All right, next slide. My key points. Number one, cancer does not end. It is not a marathon where somebody crosses the finish line and they get a medal and we cheer and move on. The experience changes as time goes. The impact and the weight of the experience of cancer changes, but it's there. Think of that glitter that I talked about at the beginning. People will find pieces of glitter for years to come, and it will look different, but it's still there and it matters. Number two, we are part of the community. We are part of the cancer community, and it matters how we show up. It matters how we take care of ourselves. It matters how we advocate for the community that we serve, how we connect. We have impact, and we are also humans who need to be cared for ourselves. So we have the opportunity to use our privilege to advocate and communicate. And then my 5 R's: recognize, refer, resource, respond, and rally. And I want to close today with one of my favorite quotes. Next slide. Sorry, Lindsay. I say this a lot in support group and working with patients. Helen Keller, I think, said it best. She said, alone we can do so little, together we can do so much. Thanks.
Baylee, that was fantastic. Thank you. You see all the love and clapping happening. Thank you so much. So we'll take a pause for questions, comments for Baylee. And Baylee, especially thank you so much, particularly a nod to our rural communities. I think it's just important here at ECHO. We want to make sure that we're keeping awareness of the needs and the resources statewide. So that was a really important touch. Thank you.
I was just going to add, Baylee, I love the glitter analogy. Thank you for sharing that. It's a great analogy.
I agree.
Yeah, that's a special patient to share with you. Any other questions, comments? So Baylee, we have a question from Marcy. How does a family member get connected to a support group?
I can really only speak to what I know of at St. Luke's. We do have a support group list with many community resources and resources that St. Luke's offers. I know there are many cancer-specific support groups that you can attend online if you're in more of a rural community without a group that's available. We did just start a group in McCall, so there is a cancer support group in McCall that's available for rural populations, but I can give that list to Lindsay to send out if you'd like, the St. Luke's list that we provide to many patients.
That would be great, Baylee. We can put that list on our overview page where you find the PowerPoint for today and the recording. So I'm happy to put that there. And then also a plug for our June 10th session. We actually have a handful of support group representatives coming to talk about their specific groups and open up that conversation as well. So yeah, thanks, Baylee. Follow up with that list. I'll make sure it's available for everyone. And then I hope that you guys join for a similar conversation on June 10th.